close to quorum, so we can go ahead and get started. As I said, this is being recorded and we'll share it with all of the working group members at GHC. I'll start by introducing myself. I'm sure I know most of you, but for those of you who don't know me, my name's Eliana Monteforte, and I'm the Director for International Advocacy and Engagement at Global Health Council. I was at the high-level meeting week at UNGA alongside Elisha DenGiorgio, our president and CEO. And for those of you who were there, or for those of you who followed online, it was a very busy week. And we know some people weren't able to attend in person, and others just couldn't make it a priority this year, but want to know what happened and what were some of the key takeaways from the high-level meeting week. So I have assembled a really great group of GHC members that were also present and are going to give us information first about the high-level meeting on NCDs and mental health and the outcome of that. We're going to go also into discussing the global health architecture and how that seems to be changing given everything that's happening within the United States, but also given that many countries that have typically supported or provided a lot of ODA are kind of pulling back, and there's going to be a lot of restructuring of how we're seeing global health. There was also a US government meeting. The Bureau of Global Health Security and Diplomacy launched the US Global Health Strategy, and we had some GHC members in the room there that can report on that. And then there were also quite a bit of advances in terms of UHC and NCDs throughout the week that I'm going to cover. So without further ado, I'm going to hand it first over to Makyba, who is our co-chair of the Non-Communicable Disease Working Group at Global Health Council. And Makyba, if you can just get us started with the high-level meeting on NCDs and mental health. What happened, what was the outcome, and what does this mean for advocates?
Thanks, Eliana. Good morning or good afternoon or good night, wherever you're joining us from. So the week, as Eliana mentioned, was a dense one with a lot of side events that happened all along in the margins of UNGA. But just a quick recap of what happened within the UN building itself. So we had the political declaration on NCDs and mental health that was discussed on the 25th of September. That is the fourth version of that document. That the zero draft was presented in May, I believe, of 2025. And since then, we've had months and months of negotiation among governments, with civil society standing up to see their interests present within the political declaration. I'll give you all the long and short of it first, and then dive in a little bit deeper. At the end of the day, we saw the political declaration, the fourth version, presented. It did not gain approval by consensus. So it will now go for a vote in the General Assembly for adoption. Now, there's been some misinformation that I've seen. It always follows this trajectory. We always have within UNGA an approval process, and then it does go on to General Assembly for adoption. This time, it just didn't get the consensus vote because we had the US block it, and they've listed their areas why it was concerning to them. Around taxes, they had a problem with taxes. They had a problem with what he mentioned, he being JFK. What he mentioned was gender ideology and abortion. Now, the latter is not mentioned in the political declaration, but those were the grounds that he gave for his objection. Nonetheless, it has a very strong backing from many governments and likely will be adopted during the General Assembly. We are very positive that that will happen, but this is where we are. We did not get consensus, so it moves forward for adoption. The president of the meeting did believe that we would have adoption, and we will have this version as our clear version to move forward that we can use to hold governments accountable by. So what does that what does it look like? And somebody posted a link to the most recent document within the chat. What we've seen is that it does include some firsts within this political declaration. I think liver diseases, this is the very first time we've seen liver diseases being recognized within the political declaration. Oral diseases, this is the first time oral diseases has been recognized since 2011. So there are some positives. We do have some targets that are included within the political declaration. And that was a concern for advocates because we saw a lot of specific targets dropping out as it moved towards this fourth version. But it does include that. It does mention taxes on tobacco and alcohol. But there are some concerns in that we feel it does not go far enough to mention sugar and sugar-sweetened beverages. It does use softer language around the taxes. It says, consider introducing taxes. It does not say implement taxes or introduce taxes, which we would have liked to see much stronger text on that. So there was some dilution of the text, and we were also looking at the weakened role of civil society within the document. So they mentioned the importance of a whole of government and a whole of society approach to tackling NCDs and mental health, but within the actionable work that they mentioned, there's nothing that talks about the integration of civil society within policy-making processes or decision-making processes amongst addressing NCDs. And then I'm sure each group will have areas where it may have fallen short. I know for the diabetes group, there's no reference to insulin, which is so important in addressing diabetes and managing diabetes. So the long and short of it is there are positives and there are some weaknesses, civil society and the role of civil society being a big one within it. But at this point, I feel like I'm happy that we have many governments that are supporting this important document, and it's a step forward. And what can we use this for? Now we have this political declaration, but then what? For me, it's a tool to hold governments accountable to. It is something that we can leverage in our discussions that we're having with decision-making bodies as to how they are managing and mitigating the impacts of NCDs and mental health. I think this is a big tool in our back pockets that we can use. We can leverage word for word some of the words that they agreed to. So we have to remember that this is something that they signed on and said that they would do. In talking about who signed on, we've had like the group of 77. They've come out and said that they strongly support this document. We have the Association of Southeast Asian Nations, the Middle East oil-producing states. They've come forward and said that they are supporting the CARICOM, which is the Caribbean nations. They are supporting this document, the European Union. So we have what I would call the juggernauts that have come forward and said, yes, we are behind this. And now I think civil society can use this document to say, you signed on to this. What are you doing towards it? Where are you in the targets that have been identified within the document, right? And there were several side events that talked about next steps. And several world leaders have talked about taking that political declaration and turning it into action and what is needed. Political leadership, multi-stakeholder collaboration, data, and of course, persons living with NCDs, which again, some persons felt like that voice was not loud enough in the actionable part of the document. So I will stop there. I'm sure we can piece it apart with each of us talking about where we felt like it fell short. But I think most importantly, we're moving forward to adoption, and we have majority of governments that are supportive of this political declaration with all its flaws. So I'll stop there.
Thank you, Makyba. That was a really great overview. I'm now going to hand it over to Rachel Gasana from NCDI Poverty Network to give her insights. And then after Rachel, James from Sale from United for Global Mental Health will talk about some of the mental health wins and maybe some of the challenges that were faced throughout the negotiations. So Rachel, thanks for being here, and we'd love to hear your perspectives on the political declaration.
Thanks, Eliana. Hi to everybody who hasn't met me yet. I'm Rachel Gasana, Senior Director of Advancement for the Center for Integration Science at Brigham Women's Hospital, as well as the NCDI Poverty Network. And our focus is on advancing access to care for severe and chronic NCDs in low-income countries. So particularly those that are affecting children and adolescents, so type 1 diabetes and sickle cell disease, rheumatic and congenital heart disease. And I would say, adding on to this excellent description Makyba just shared of kind of what is in the document and what the process is like and where it was, the value for us has been in first engaging in the process. And I think there was a lot of clarifying both of our own stance and with our fellow organizations and network countries, as well as network partners, of saying what is important to us and really having that reset moment and being able to articulate that and share that with a lot of different stakeholders was a huge value to our overall advocacy movement. And then the political declaration or the high-level meeting, excuse me, itself was a really great litmus test for how effective have we been with our advocacy, particularly with government stakeholders. And being able to kind of hear for the first time ever some of these severe and chronic diseases, and then Penn Plus, the package of care that we've been working to advance, that actually being named as part of the comments that countries and coalitions were able to make during the public comment section. So this was very encouraging for us and for our network members. Think of just having been a very long process of opening up the global NCD dialogue and what's considered the importance and priorities in NCDs, and ensuring that these conditions and these populations are included in that dialogue. For the political declaration itself, I think, again, Makyba gave an excellent summation, and I agree with pretty much everything she said. We're very encouraged to see children mentioned many more times in this version of the political declaration than even the first version of this one, and definitely previous political declarations and NCDs. So that was fantastic. And I think there's work to be done and build on in the next steps here of how do we really think about a child health agenda, UHC and NCDs. What does that actually look like when we're talking about the particular conditions we're focused on? There's a real nexus there. And is this an opportunity to drive forward some more of that integration and collaboration with those agendas? Encouraged to also see sickle cell disease named in the political declaration. But again, I do, you mentioned Makyba around diabetes, insulin access. There are obviously some core parts of, or core priorities that we're working towards that aren't reflected. That said, a declaration that's drafted to get to consensus, but the point is consensus, and also to encompass all of the many issues and multi-sector issues that touch on NCDs is a tall order, and there's always going to be things that are left off, right? And particularly this year in this context with the US, and I thought it was very interesting how the US positioned itself here and very publicly stated, we're not working in a multilateral way, right? We've already said this in many other ways, but in our 3 minutes, we're going to just state, frankly, we're not working in a multilateral way, but at the same time, NCDs are a priority, which is an interesting statement to hold the US to. But it also emphasized to us the growing importance of bilateral engagement, that's more important than ever. And by bilateral engagement, the work that we're doing in our advocacy and policy work directly with country teams, ministries of health, and then increasingly thinking about what does that look like in the, on the political side to really center NCDs and create momentum towards better access to care. So I would say in conclusion, there's really two signposts. There's really two things you could do with this political declaration for your own advocacy goals. One is, as Makyba said, really holding to public commitment. So if it's stated as it's a priority, this country government has signed on and sort of publicly stated that they endorse this. These are phrases, what are you doing about it? What does that look like in our context? How are we going towards these targets? Do we have data for these targets? How can we as civil society support the countries as a whole along this pathway towards better access to care and better outcomes? And honestly, the other way to use it, though, is to say, look, this political declaration has a lot of gaps, and it was clearly influenced by industry. And so using it almost like as a negative to say, or a photography negative, right? So like if you see the gaps, that's actually a great reason to have a conversation as well. And that's something to lean into as well. So we see that there's no targets for persons living under the age of 30. Well, that's actually a really great thing to say, okay, if I'm working with, whether it's a regional office of the WHO or whether it's with countries themselves, but really press them on, well, this actually hasn't been outlined, but it's really important. We can kind of convince you and show you data of why it's important. What are we going to do? How are we going to be a leader in this space? Because it actually hasn't bubbled up. And so how are we going to create sort of leadership opportunities? So really using the political declaration as a political tool for our own advocacy efforts is a really powerful moment, and it's a powerful tool. And it's a great signpost as it comes up every couple of years of how well we're doing on really reaching the people who have power. So thank you for the opportunity to share our perspective. And Eliana, should I hand it back over to James?
Yeah, go ahead. Go ahead, James.
Yeah, thanks very much. I'll try to add something. It's been very well covered so far, the high-level meetings. Thank you to the previous speakers. But I've just got 3 points, I suppose. And the first is that we very much view it as a political document, this political declaration on implementation guide, and we understand its limits in terms of the remit it has. So I took the example of what we call deinstitutionalization in the mental health system. So moving from mental health asylums to care given in the community and at primary healthcare level. It's probably the greatest reform that mental health systems could make in any country around the world. It's huge. That's just 18 words in this political declaration, and that's good enough. We have guidance from WHO on how deinstitutionalization can be done. We have case studies. We have regional strategies and plans for how that can be done, and national ones as well. This reaffirms that commitment in a political manner. It sends signals to funders and donors, not just those managing tax, but those managing contributions from governments, to say multilateral funders, that this is a priority, and that's good enough for us. So we very much see it in that way. But I understand the frustration in the details and in some of the areas. The mental health community set out about 15-16 months ago to understand, or to have some consensus ourselves on what the priority areas would be for mental health, seeing as mental health was suggested at that point that it might be in the title for the first time, that mental health might have more prominence. So okay, we're going to seize this opportunity. Working with lots and lots of mental health civil society at different levels, subnational, national, regional, global, and then technical UN agencies, multilaterals of all sorts. 3/4 priority areas came through, which were suicide prevention, deinstitutionalization, which I mentioned before, child and adolescent mental health, and then the one I said /4 was commercial and social determinants of mental health, understanding that that's an area that's cross-cutting for NCDs and mental health. And if we judge the political declaration by those areas, we feel it was a aggregate success. So starting with like the really good things, the suicide prevention paragraph, I felt like that could have been written by technical experts in civil society. I mean, it's excellent. We're very pleased of how that has come across and how the final language is. Child and adolescent mental health, like everybody else, we're very disappointed in the zero draft, but as we sort of redoubled efforts there. That's come, child and adolescent mental health has come through fairly strongly. It's sort of integrated into wider systems text. And then there's this additional thing about the online environment for young people and making sure that young people are protected. Deinstitutionalization, as I said, there's that 18 words on deinstitutionalization, but there's sort of that, I think the approach of integration and integrated NCD and mental health care at primary level does come across throughout the declaration. And then that last point on social and commercial determinants of mental health, it was always going to be difficult. I think our bar was quite low in that we just wanted mental health to be recognised as part of the discussion of social and commercial determinants. So that when we talk about regulation on tobacco, that's not just a physical NCD issue, that's also a mental health issue as well. And I think that area, I think we got some progress in terms of the education in that area. So those are sort of the four areas we looked at. And then in looking at legacy, well, I mean, only last week we had the World Mental Health Summit in Doha, where, you know, the outcomes of the text in the political declaration were discussed, and there's always a ministerial communique that comes out of the summits, and that was reflecting. Next year we'll have the first World Mental Health Summit on the continent of Africa. That's very much at the moment been pitched as a 1 year on from the high level meeting, what progress has been made. There's UN agencies that are already developing monitoring tools for the commitments and language within the political declaration, and so we can gauge how much progress has been made. So there's already quite a lot of work happening to do that. Which is really encouraging to see. I think, again, just getting back to that point about it, seeing it's a political document, is we now have sort of 6 years to pressure for the implementation of the commitments that are made and to thrash out those details. And so Rachel was saying, you know, spotting where the gaps are and then using that as a tool to say, well, this is an area where we can make progress and we can see political commitments made in other forums. You know, in the mental health world, we have next year at the Human Rights Council, there'll be the renegotiation of the mental health resolution. There's a resolution on children and human rights, which we know there's 4 paragraphs being allocated to mental health. We want to make those as strong and consistent with the high level meeting as possible. So we have these opportunities already on our horizon. We can echo the language. And frankly, you know, if I understand there's some frustration with the targets, and I do get that. However, you know, speaking to friends and colleagues that work in national health systems around the world, you know, they're saying to me, if 80% of our primary health facilities have available essential medicines and basic technologies for NCDs and mental health at affordable prices in the next 6 years, they'll be over the moon. They think that's almost unrealistic. So I think that there are elements of the political declaration where, yes, we feel it's not as ambitious as it could be, but I think we should like celebrate the wins as well. And then we've got 6 years to pressure that implementation and to get to these targets. So I think it's like a glass half full from the mental health community, and that's the sort of feedback I'm getting back from others.
Awesome. Thank you so much. I just think it's really important to understand, you know, what's in the outcome document, what's not, why both of those things are important. And then I think everybody here did a great job of explaining, you know, what do you do with this political document? What should advocates continue to be fighting for? So thank you so much. I'm now going to move on to Molly Moss and Camden Malone from United Nations Foundation. They're going to be talking about the global health architecture developments. Handing it over to you. Go ahead.
Thank you, Eliana, and good morning, everyone. Great to be with you all. Just would love to start by appreciating those who've spoken already to say what a great analysis of the declaration and the meeting to a lesser extent. And I would also really commend the advocacy of United for Global Mental Health. I think you guys did amazing work in the run up to this meeting, and everything that you just kind of described, James, is a testament to how the policy process works, right? And the way that you're looking ahead to the future about how to continue bending the policy arc in the direction that you want. None of this is a silver bullet. It won't solve anything on its own. So contextualizing it against the broader process, I think, is so important. Camden and I are just going to zoom out a little bit on what else is happening in the UN, both in the context of global health and global health architecture reform, which I'm sure is on the tip of the tongue of many in this call. In New York, we saw many discussions on the issue of global health reform. There are many ongoing processes, some of which you all are engaged in. The EU and like-minded donors have started a reflection process. They'll produce a report by the end of the year. Wellcome Trust is hosting 5 regional dialogues on health reform. Tomorrow, we'll launch a new civil society-oriented effort around reimagining global health architecture. I believe this link was shared previously, but I'll resurface it here in case those of you want to join. All of this is to say that there's just a lot going on, and I would draw your attention in particular to a session that took place in New York that was hosted by Ghana, and it is the Accra Reset, which builds on work that started in August, and I think we can expect to see much more being done on this lane of effort. The president of Ghana himself is leading this initiative, and it is kind of contextualized as an Africa-led solution to address the failures of the multilateral system on health and development. I will put another link here in the chat to the session that happened in New York, which I think was really quite powerful. We see many influential Africans kind of describing what they see as the mindset shift that is needed to kind of get to where we're going in terms of African-led health sovereignty. So I won't try to describe all of the pieces of this. It's really quite rich, and there are a lot of important points to be made. So check out the recording if you have time. It's a good use of a couple hours. Moving on to the UN more broadly and the UNGA80 reforms that were also a big topic of discussion a couple weeks ago. There are 3 work streams for UNGA80, and perhaps the third work stream is the one that is considered most important as it addresses potential structural changes in the UN. And just ahead of High Level Week, the Secretary General released this report that articulates a possible way forward. Those on the call will be aware that it kind of generally proposes the sunsetting of UNAIDS in 2026. It also just describes generally the need to defragment and create greater efficiencies on health and humanitarian work streams. So it indicates that WHO, UNICEF, WFP, and others need to be working better together on their functions. Being conscious of WHO reform, I'm not quite sure how this will play out. The UNGA80 reform and the WHO reform certainly relate to each other, but I don't think those two processes are quite like talking to each other yet. So lots to understand still about whether WHO will evolve in a more normative way, which some countries want to see, or whether it will take on some of the operational and practical responsibilities, which is what I'm kind of gathering the UNGA80 process is envisioning. So lots to still unpack. There were no decision points made on UN reform last week or 2 weeks ago, but it is a really, active area of discussion. I think I will leave it there because Camden has a few more pieces to add, and I know we'll take some questions at the end. So over to you, Camden.
Yeah, thanks so much, Molly. And I hope that the points I'll come in with very briefly won't really pull away from the focus on NCDs, but can just kind of contextualize how this high-level meeting, which is designed to capture high-level political attention, takes place in the backdrop of a very busy week. To start, over 130 heads of state actually came to town for UNGA, but we know only 9 attended the NCDs meeting, and that's a step up from last year on AMR, which drew only 1 head of state actually, but it's also shows how this issue falls short of commanding priority over some of the more politically salient happenings throughout the week. So I'll just very briefly cover 1 or 2 of pieces of the bigger pie, which NCDs was a smaller slice to. First, Preceding Prime Minister Netanyahu's visit to New York was a high-level meeting early in the week on the two-state solution. That was the continuation of a session held earlier at the UN in July. The meeting featured virtual remarks from President Abbas of Palestine, who was denied entry into the U.S. And was therefore unable to participate in person at the assembly. And he was not the only travel restricted, as other high-level representatives and diplomats who the administration is not on good terms with were also denied in strict violation of the U.S.'s obligations as the host country. President Abbas used the virtual platform to promote support for Palestinian statehood and to urge Israel to engage in further peace negotiations. And of course, following the assembly, we know that Prime Minister Netanyahu visited DC to meet with President Trump, and there's been a few more developments there since. Just a few notable outcomes of that meeting included that the EU announced a new donor group to form for Palestine, as well as a call from Indonesia and Senegal to explore the deployment of a UN peacekeeping mission. And that's a somewhat perhaps inconceivable course of action at this stage since it would require the US's approval on the Security Council. But I think I just mention it here to show that this is an issue which not only really reigned supreme on the UNGA agenda, but also a place where member states are throwing a lot of their political capital. Lastly, I'll mention the high-level meeting to commemorate the 30th anniversary of the Beijing Declaration. That's considered the most successful or progressive blueprint ever created at the UN for advancing women's rights, which of course 30 years later still lags behind in terms of implementation and where inequities continue to persist in virtually every corner of the world. But the meeting itself was, I think, a timely pause for reflection on where progress is or especially isn't, noting that an estimated 90% of women's organizations are facing steep cuts, and the emerging focus on some of the different conditionalities for bilateral foreign assistance, including the exclusion of certain work on gender or SRH, would add further concern. So some member states, just on a bright spot there, are swimming against that current. Luxembourg doubled its contributions to UN Women. Qatar pledged over $2 million to the UN for implementing the declaration. In Australia, announced that it's mandating 80% of its own aid to address gender equality. So a few bright points there. And I'll just conclude with a note on this sort of gender equality fight and its history within the UN, to say that it also bubbles to the surface around this time in the election of the next UN Secretary General. UNGA is a stage this year for some unannounced candidates so far to start gaining their sort of red carpet to their announcements, and we'll soon see a few front runners probably start to emerge, along with a very concerted push for the first ever woman SG. And whether it is or isn't a Madam Secretary General, I think that it's fair to say, given the breadth of the challenges and the reforms underway which Molly described, that they'll inherit a very heavy mandate, which in large parts would already be pre-baked by some of these difficult circumstances and plans set forward by the current UNGA80 initiative. I'll stop there. Thank you.
Great. Thank you so much, Molly and Camden. I think sometimes we get so focused on the high-level meeting that we forget there's so much else that goes on the week of the high-level meeting week, and also just throughout the 80th United Nations session. There's going to be a lot of other topics that are going to be discussed and negotiated. So great to get that view. I'm now going to pivot us to get a summary of what happened at the Bureau of Global Health Security and Diplomacy event, where they launched the U.S. Global Health Strategy. And for that, I'm going to have Kristie, Mikus, the Executive Director of Global Health Technologies Coalition, start by just giving us an overview of what happened. And then we're also really happy to have Margaret McDonnell, who's the Executive Director for United to Beat Malaria, which is a campaign at the United Nations Foundation, who is also in the room and will give us her perspectives. So handing it over to Kristie.
Great. Thanks, Eliana. And just want to congratulate the speakers before for the really fantastic overviews. I think in the future, I would seriously consider, if we needed to cut costs, not going to some of these meetings, because you all covered it so well. I feel like I've been there. So thank you so much for the good overview. So yes, with regards to this new strategy launch, so the U.S. Chamber of Commerce convened a high-level dialogue with leaders from the State Department, DFC, private sector, and they pulled in some African ministries of health to discuss this newly launched U.S. Global Health Strategy, which I'm sure many of you have seen. It's called the America First Global Health Strategy, and its implications for global partnerships and health security. The event opened with remarks from Jeremy Lewin. He's the acting Undersecretary of State for Foreign Assistance, Humanitarian Affairs, and Religious Freedom at the State Department. And he called the strategy, but he really talked about it as a refocusing of U.S. global health assistance towards self-reliance and suitable national health systems. Of course, you know, the self-reliance is a language that we've heard before in conversations regarding U.S. aid. And two quotes that he said specifically, and I usually write down quotes because I feel like they speak for themselves, but he said that we want to put countries in the driver's seat. The U.S. role is to be a helper, to deliver American innovation and scale, but not to dictate how countries run their own system. So it gives you a sense of sort of where State Department is coming from with respect to this strategy. He also emphasized that the strategy represents a shift away from what he called parallel donor systems and NGO-driven delivery models toward country-led approaches anchored in private sector growth, especially across Africa. He highlighted that the U.S. aims to create these multi-year bilateral compacts that tie investments to clear performance benchmarks and co-financing commitments, saying that success will mean countries gaining control of their own national healthcare systems. And he had mentioned sort of casually that they had already had 3 or 4 of these meetings with ministries of health prior to the launch of the strategy that very morning, and that they had another, 12 or 15 scheduled throughout the week. So they're announcing the strategy, but also very much already moving into this space. Then we had a strategic overview by Brad Smith. We understand Brad was one of the lead architects of the strategy, traveled through Kenya and Uganda, sort of, drafting bits and pieces of it. His official title is Senior Advisor in the Bureau of Global Health Security and Diplomacy. And he walked around the 3 core pillars of the strategy: safer, stronger, and more prosperous. So safer defined as strengthening outbreak surveillance and epidemic response; stronger, building resilient national health systems through multi-year bilateral agreements; and then more prosperous. The way that they're couching that is promoting American health innovation and supporting private sector engagement globally. There was good recognition of PEPFAR's progress. They talked about the 26 million lives saved and 7.8 million babies born HIV-free. But then they also talked about how less than 40% of the current funding reaches frontline services. So something that Brad said directly was that over 60% of funding goes into technical assistance and program management. And we want more of that money going directly to the front lines, to commodities, diagnostics, and community health workers. He also talked a little bit about supply chain inefficiencies, including USAID's survey that found that donor-funded medical goods were being resold in 25% of outlets visited. I know for me that was new information. They had a slide on that, but they did share that, so I don't know how widespread that was. But again, new information to someone who's been working in the PEPFAR space for a while. And then he talked about how future bilateral compacts will include these co-financing mechanisms and the shared accountability for performance outcomes. So there were 2 panels directly after the speeches, so to speak, and they were reactions from African ministers. The first panel featured His Excellency Professor Mohammed Pate, Minister of Health for Nigeria. And then they also had Dr. Sabin Sanzimana, Minister of Health of Rwanda, and they both really welcomed the new strategy's focus on ownership and predictability. They talked about how it aligned with their own country's health reforms. Pate said that Nigeria's reforms were already prioritizing domestic financing and private sector engagement. And he talked about them not wanting to be perpetually dependent on external financing for basic services. Sanzimana echoed the sentiment, basically said similar things. And then both of them cautioned that co-financing should be flexible and it should be aligned with countries' national budget cycles rather than rigid ratios, which come from the US government or have in the past. And then they didn't really have in the panel session, they had some private sector representatives, but then they didn't really have an open Q&A session. They also had private sector sort of teed up in the audience to give some remarks, most of which they seemed like they were prepared from my perspective. But they did have a couple industry leaders on the panel. They had Daniel O'Day, CEO of Gilead, and he talked about the partnership with U.S. government and lenacapavir, the twice yearly injectable HIV drug. And then they had Caitlin Burton, who's the CEO of Zipline Africa, and she talked about drone-based delivery systems. Again, it was a great chance for private sector to highlight what they've been doing, how they've been involved. Then they had Jeff Graham speak. Jeff Graham has been sort of the senior bureau official at Global Health Security and Diplomacy at State Department, and he talked a little bit more about the reorganization at State Department, including what they called the absorption of USAID health programs and the integration of TB, malaria, and maternal and child health portfolios. And he said, we went from a $4 billion strategic platform to a $10 billion implementation platform overnight. But the goal is seamless continuity, no interruptions, and life-saving care. So certainly a big goal there. Then we had Nafisa Jawani, who was head of the DFC's Global Health Investment Portfolio, and she really talked about DFC's growing investments in regional manufacturing capacity and health technology infrastructure. Really, I thought that was a welcome contribution to hear how they're pivoting and wanting to wrap around this. So for me, some of the key takeaways are that there was strong alignment between the U.S. vision and partner country priorities for self-reliance and private sector engagement. There was also a lot of talk of integration. I think people welcome this strategy of having a more integrated approach across diseases, data systems, and agencies, and that really is something that's important to achieving cost efficiency and sustainability. I think the implementation capacity at both country and U.S. government levels is going to be a critical component, particularly as state absorbs USAID functions. Do they have the necessary capacity in place? A lot of us fear that they do not have that capacity, but also regulatory harmonization, supply chain transparency, local market access. These all remain challenges that could really limit progress if not addressed. We didn't really get a chance to get into some of those details, and I think they're going to have a more detailed implementation plan forthcoming. So the discussion was generally optimistic and forward-looking. It was nice that they talked about, PEPFAR successes and U.S. global health investments writ large, but they just kept kind of going back to saying that we can't keep building parallel systems and calling that progress. And they said directly that real success is when our partners no longer need us. So yeah, so that's the sort of play-by-play of what happened there. Notably for me is that also there wasn't like this robust interagency presence, which we normally would see in something like this, especially as PEPFAR is famous for saying, check your uniform at the door. We all are as one team. There actually wasn't anyone from, aside from Nafisa from DFC, they didn't have like HHS or CDC on the panel. There was actually no one from CDC even there, which as a former CDC person, just like broke my heart. As a remaining implementing partner, like they just weren't there. So that was really unfortunate from my perspective, but I hope that they were looped in on the strategy. So let me turn it over to, I think, Margaret, Eliana, if that's appropriate. I know Margaret's going to give a little bit more intel too. Thanks.
Go ahead, Margaret.
Great, thank you. Well, thanks. Well, hi everyone. I'm Margaret McDonnell, UN Foundation. Kristie gave a very comprehensive and detailed play-by-play. So I think the only things I would add, and definitely agree with everything she said, I think, and I'm trying to set my personal feelings, obviously, about everything that's transpired over the last 8 or 9 months aside. I think there are some positive developments, at least in words, in terms of integration, countries being in the driver's seat. And I think the challenge to me kind of leaving was still the how. And also just want to recognize that it's integration when it comes to HIV, AIDS, TB, malaria, maybe some elements of maternal child health, but of course, many of the issue areas that many of us work in and care about are not included. SRH, anything around gender, LGBTQ+. So there's obviously some gross omissions, at least in terms of the administration strategy. I think there's also, with this emphasis on bilateral, so essentially, as Kristie mentioned, the idea is they want to have compacts, multi-year. They said they'd be between 2 to 5 year, multi-year bilateral compacts with countries, and that they're on a very ambitious time frame to have those wrapped up by the end of the year somehow. And so I think there's a lot of questions, as they mentioned they were meeting with, I don't know, 20 or so countries that week. So I think there's a lot of opaqueness around that process, what that looks like, especially now that the government is shut down. Of course, many of these people will probably be deemed essential and continue to work. But there's a question in my mind of how are these meetings unfolding, and how do we ensure that global health, and many of the issues that we work on are prioritized and in a responsible way. I think another thing that really struck me is, and I've heard this from people who are, working within the GHSD team, is that the vast majority of people, at least those in leadership positions, do have an HIV background. And so their paradigm for viewing global health is really through the lens of PEPFAR. And so, there seems to be kind of this push to integrate other programs around the PEPFAR sort of model and systems. So I just think that's something we need to be mindful of and ensure that if there is really this integrated approach, that it is in fact integrated and understands sort of nuances and differences across sort of health areas or disease focus areas. I also think the faith-based element. So as Kristie said, in many ways, the event, I was pleasantly surprised in the sense of acknowledging progress and some of the principles we've laid out. But they did start talking about, the waste, fraud, and abuse of NGOs and Beltway bandits and that kind of stuff. So there's still work to be done there. My, assumption from sort of what they said there, as well as other conversations I've had, is they, I think they're really going to be looking to faith-based organizations going forward in terms of the implementation. So that's just another thing to be mindful of. What else? I think that's all I'll say about that event specifically. But I did also join the prayer breakfast, which it turned out I was sort of confused about why I was invited, but turns out it is a PEPFAR annual breakfast that happens during UNGA, so it's not unprecedented. I just happened to be invited, even though I don't work squarely in HIV. And what was interesting there, again, pleasantly surprised, but I think that's largely because the NGOs implemented it. So there was a wide array of faiths represented and leaders giving various, prayers and reflections. I think the other thing that struck me about that event was a professor, Dr. I think it's Sibley, who I guess used to work at State, I believe, gave a presentation around the importance of not having a disease-specific approach, but having a child or a mother or a person-centered approach and reflecting sort of integration. And, in this case, he pointed out that the reality is, because of the success of PMTCT and all the other efforts, only about 2% of child deaths are attributed to HIV. And so if we are to have a child-centered approach, which is, I think, a priority for this administration, in theory anyway, is for it to truly be integrated and not solely focus on HIV, obviously. So anyway, I'll stop there because I know you also want questions, but hope helpful and happy to chat now or anytime. Thanks for the opportunity.
Thanks so much. That was really comprehensive. I know some people might have questions, so I'm going to go through my section very quickly. I wanted to mention some of what was happening around UHC, Universal Health Coverage advocacy, only because with all of the changes in the global health landscape, there's obviously this fear that we're going to start going into our silos and our disease areas. And so UHC 2030, along with many member states, have really been pushing for UHC, since it really is a way to include all disease areas and to make sure that all disease areas are benefiting as countries try to strengthen health systems and strengthen primary health care to achieve UHC. So I wanted to talk a little bit about how it appeared that week. And the first thing that I'll mention is that there was a launch of phase 2 of a WHO European Union UHC partnership. This is a really important partnership where WHO seconds staff to Ministry of Health to help with the health system strengthening and strengthening primary health coverage. And it was really great to see that that's continuing on. And there was a significant amount of money that was committed to it through the European Union. So I think it was about 40 million euros. So that was really good to see in terms of continued commitment to UHC. There was also a formal meeting on social participation and health equity that was organized by Slovenia and WHO. Social participation obviously being incredibly important to achieving UHC. And we talked about how there was very weak language around social participation in the political declaration. And so it was great to see this event take place and so many countries come in and talk about how social participation is really key to health equity. And it really isn't an option, and it's foundational to UHC and democratic resilience and sustainable development. So we did have Slovenia, Kenya, Spain, Brazil, Thailand, Malta all participate. The only downside to that session was that there really wasn't a whole lot of participation from civil society. I think they allowed like one or two non-member state comments, and I think one of them was from civil society. So that was a little bit disappointing, but it was great to see this commitment to social participation. And then there was the 6th annual Group of Friends of UHC meeting that took place, and that was hosted by Georgia, Japan, and Thailand, as well as WHO and UHC 2030. And really, it was great to see that Dr. Tedros was there at the event and, gave his opening remarks, but stayed throughout the discussion. And that really showed in all of the changes that are happening and prioritizing that's happening at WHO that UHC really still remains a priority to them. And during that discussion, it really revolved around focusing on the whole of society and the people-centered approach and making sure that there are political commitments, but also sustainable financing. And there was different discussions around, how financing needs to change now that our global health landscape is changing. And then there was also a lot of discussion too about making sure that we're funding, not just saying that we're supporting civil society participation, but that we're funding their support, which I think was great. And just to give you a sense of the countries that remain, very committed and were at the event, it was Japan, Georgia, Thailand, Slovenia, Gambia, Kazakhstan, Colombia, Sweden, Antigua and Barbuda. So I can, you can get a sense that there's still a lot of commitment to UHC, and that was really good to see. And then last, even just within the political declaration, in the first zero draft of the political declaration, there wasn't really a whole lot of mention of UHC, but there is now a paragraph that focuses on UHC and how it's essential to the prevention and control of NCDs, which was a huge win. There was a whole section on the fundamental role of primary health care, which is really great to see. There wasn't mention of social participation per se. There was a little bit on including civil society and people with lived experience in policy development and implementation, and also diagnosis, treatment, and care. And of course, there was a lot of mention of human rights-based approaches, which of course, when we talk about UHC is really important. There was a lot of acknowledging of, recognizing inequities of NCDs within poorer countries, but also within various different populations. There was a lot around access to vaccines and tech transfer, affordable medications. So that was really good to see too in terms of UHC. And then there was also mention of developing and supporting national and regional capabilities for data disaggregation, which was also really good for the UHC movement for that to be acknowledged. So I'll stop there. In summary, I think UHC really came up strong, and I'm really happy to see that not only WHO, but various member states are still very committed to it. And we're still moving forward with our UHC advocacy. So I know we only have five minutes left. If there are any questions, I know some people had some questions in the chat that were answered, but if anybody would like to ask a question, now would be a good time. And I know this was very comprehensive too, but go ahead, Camden.
Thanks. I just have a quick question for James, actually, on the mental health side. And to say that in New York, it feels like we see a very select group of member states, a coalition of the willing, that's really driving this agenda of mental health in New York, health diplomacy. Curious through your own lens and advocacy experience and your analysis as well of the process and the outcome, if you feel like this has collectively made a effective push to bring more member states that are in the middle of that road along and to help sort of expand that, broaden the support base, but also the policies in those countries.
Yeah, thanks, Camden. I think it's true that there are a group of member states that are pushing on mental health, that taking it as one of their issues. And that group used to be really small, like 5-6 years ago, but the group has gradually expanded and changed. Like people rotate, like in no official way, have rotated in and on and off of that. And we see a different group, an overlapping but different group in Geneva. And in other places as well. So it's not as consistent. We don't see that so much joined up across ministries of foreign affairs where their diplomats are based. However, yeah, I do think that is true. So there's a core group that are driving on, and I think we were fortunate or different mental health actors pushed for those member states to be the ones that were negotiating on behalf of blocs, or that were in positions to influence the ones who were holding the pen for blocs. And that was quite a successful approach. But in all honesty, I've worked in different areas of the health sector in terms of advocacy, just different issues, and it hasn't been the hardest sell. I actually think the door has been slightly ajar for mental health discussions with those groups, and that group is slightly, as I say, it has increased because of that. So, yeah, you're right, there is, but I think it's the same for any issue. You've got member states to take it on as a priority and then drive that through. We saw, and you're right in that we saw an increase of member states join that group, like whatever that unofficial group is. But also, I do feel that we are moving towards, and this might happen to lots of different issues, and you have your moment, and it might be just that mental health is having a bit of a moment, but it's like we're moving from mental health being noticeable by its inclusion to mental health being noticeable by its absence in the global health discussions. And it feels like the job isn't done, but there is a slight swing towards that. So as well as that core group, I feel like a lot of member states feel it is a prerequisite to giving their statements at things like a high-level meeting on NCDs.
Great. So I think we're at time, and I really want to respect people's time. If you do have any questions, feel free to email me or any of the speakers. If you want to get in touch with any of the speakers, please also email me, and I'm happy to put you in touch with them. There were a lot of updates. As you can see, it was a really, really busy week, and we wanted to make sure you had all the information. So I hope this was helpful to you all. And thank you to the speakers. Really appreciate your support, and to all the people who attended today. Thank you very much, everyone.